also is instrumental in the Savvy IMG, and a lot of you guys would have heard of the Savvy IMG. They're a great company that help IMG doctors in various different ways, and they have their own resources as well. So we've got to know the Savvy IMG and Kimberly and Nick for 4 or 5 years now, and they're great at what they do. The advice they give is very sound. We'll let you take over and wow them with some of your stuff.
Okay, thank you. Thank you for inviting me again to give this talk about a career in ophthalmology in the UK. I don't know how many of you guys are interested in ophthalmology, but I'm hoping that those who are, you're going to get something really good out of this talk, and those who aren't, maybe you become interested in it because it is a very exciting and very rewarding specialty. So let's get into it. So there's quite a lot I wanted to put into the talk, but I've only got a short amount of time. I may have cut it short by being late. So we're just going to give you as much as I can, as high yield as possible, and as much practical advice so that you can get started right away. So if you saw my talk last year, it's quite similar, very similar, with a few updates. So definitely stick around, and hopefully you'll get the latest advice. So the 3 main parts of my talk are about my own journey as the first part, and then ophthalmology as a career, and then how you can plan to get into training in ophthalmology in the UK as an IMG. And again, just as a disclaimer, this is a very simplified overview. I hope that you just see this as kind of the start of your research into a career in ophthalmology here as an IMG. We do have plenty of other articles about coming to the UK on our website, the Savvy IMG, and we do have a guide on specifically for ophthalmology, different ways that you can get GMC registration, different types of jobs that you can try and apply for when you're coming here. And I know that the guide is quite long, it is comprehensive, so I know it can be overwhelming the first time if it's the first time you read it. So that's why we have started doing coaching calls for IMGs who are looking for that personal one-to-one guidance. And this is the link that you can go to book a session. And it's not just for ophthalmology, for other specialties as well. If you just want a good overview about your career and how you can get to the UK, and you need one-to-one guidance, then that is something that you can do as well. So let's just start with my own personal journey. I was born here in the UK, and then when I was about 13 years old, we moved to the Philippines. And so that's where I completed my education. So my first degree was in biology, and then I did medicine as a postgraduate degree, and I graduated in 2013. So that first year after graduation was when I did all my GMC registration, IELTS English test, PLAB 1 and 2, and all that. And I applied at the same time, I applied for the UK Foundation Program. So I did not do my internship in the Philippines. I did it here in the UK. I did FY1 and FY2 here, and that started in 2014 and in 2016. And right after finishing the foundation program, I started ophthalmology training, and I've been in the South London Deanery since 2016. So I've been working at Epsom and St Helier Hospital, Moorfields at St George's, King's College Hospital, and currently I'm on a bit of a career break as we're dealing with some family issues. So hopefully going back into training next year. And so that's my journey so far. And what about ophthalmology as a career? So some of you may not have even considered it. And actually, I was one of those medical students and fresh grads who didn't think about a career in ophthalmology. And really, we don't focus on it a lot at medical school. So how could you consider it as being your career? So I wanted to just talk about what ophthalmology is like and why it's so great. So one of the great things about ophthalmology is the diverse pathology. So you can get lots of benign conditions, which is probably our bread and butter. You have conjunctivitis, corneal abrasions, dry eyes, cataracts, but you can also encounter sight-threatening conditions that require immediate treatment, whether that's through drops, oral medications, surgery, or injections into the eye. So there's corneal ulcers, ankylosing glaucoma, uveitis, retinal detachment. But also the eye is the window to the soul, and you get lots of medical pathology, surgical pathology that can be life-threatening and present with eye symptoms or eye signs. And so it's really important to have not just to look at people as eye stands, you know, look at the whole person, and think about everything you've learned in medical school. It doesn't go to waste. When you go into ophthalmology, you have to use it as well. You have to be able to recognize those systemic conditions when you're looking at a patient and assessing their eyes. So other things about the specialty, it is very, very rewarding. So it's a very rewarding specialty because we have a lot of effective treatments, effective interventions, and they can be life-changing for our patients. So I'm not sure if this is showing. Okay. So they can be very effective for our patients. They can be life-changing. You can go from blind to 20/20, depending on the type of condition you have and the type of treatment needed. And having that impact on someone's life, it is very fulfilling. It's also very, you know, no 2 days are the same. There's a lot of variety in the work week. So there is medicine. You do have clinics. There's surgery. There's laser. There's a lot of, you can go into research. It's very, depending on what your interest is academically or clinically, you can find a place in ophthalmology. It's also mostly office hours. You know, work tends to be 9 to 5, although you can come in early. Obviously, for surgery, you may finish late, but in general, it's quite family friendly. We also have a lot of technology in ophthalmology, a lot of imaging modalities that other specialties have no idea, that things that we can look at, things that we can assess. And it's a lot of fun learning about these new technologies and using them in clinic. And if you're into research and you like something fast-paced, then definitely consider ophthalmology, because the ophthalmology now compared to 10, 20 years ago, it's so different. In 10, 20 years time, it's going to be very different as well. So if you like that rapid change, then ophthalmology is definitely one to consider. But having said that, it is very busy. The workload is always increasing. There's a huge backlog now because of COVID. We've had to, you know, postpone a lot of our elective procedures and non-urgent cases. So there's a very, very high workload. It has, or the specialty of ophthalmology has the most number of outpatient specialties in the outpatient visits in the NHS each year. So it's very, very busy. So you're not going to be out of a job if you go into ophthalmology. So on the next thing that I was going to discuss, hopefully when my PowerPoint moves on, it's about, there we go, typical timetable. So if you're wondering what we do every day as an ophthalmology trainee, I just wanted to show what the timetable is like. So this was my timetable pre-COVID, and as you can see, it's very easy to section off parts of the day. So every half day is a different activity. So there's a mixture of clinic, there's theatre. We also have regional teaching, which is a half day each week, at least in South London. Then I have the emergency clinic once a week, and I also have CPD. So we get 2 sessions of CPD from ST3 onwards, which is the time that you can do audits and quality improvement, do some write papers and that kind of thing. So at least we have that scheduled into our day, which I know a lot of other specialties have difficulty getting, but we always get ours. So that's really nice. So ophthalmology training. Let's talk about the different pathways. So there are 2 different pathways to complete training in the UK and get the certificate of completion of training, or the CCT. So there's the CCT pathway, which means you've completed the full 7 years of ophthalmology training in the UK. And then there's a CCP pathway, which means that you entered into the 3rd year and you completed 5 years of the program. Both of them will get you a CCT. But the difference is how much experience you already have in ophthalmology. So if you have 0 experience or less than 18 months, so all the way up to 18 months, then you can join, or you can apply for the CCT pathway. So you can apply for ST1 in ophthalmology. However, if you have more than 18 months experience, then you will no longer be eligible for ST1 because you're over experienced, but you can apply for ST3, although you need to obtain 6 more months. So you need 24 months of clinical experience in ophthalmology, plus exams and surgical experience apply for ST3 training. However, I have been told by my training program director and my college tutor just this year that there are plans to close ST3 recruitment. So we haven't been told when, but that means that if you want to enter training, you would have to go through the CCT pathway, meaning you need to have less than 18 months experience. So how many places are there in ophthalmology each year? How many places are we all competing for? So each year there's about 70 to 90 places in ST1, and there are about 4 to 6 doctors applying for every available place. So that's a competition ratio of 4 to 6. In ST3, there's usually around 20, with around 3 applicants per available place, so maybe like 60 or 70 applicants. But it is, as I said, it is going to be closing soon. So I would not aim for that as your primary pathway, just because that might not be available in the coming years. So here's the kind of bulk of my talk, which is about how to get into UK ophthalmology training. And I'm sure you've heard all day from lots of different IMGs who are in training in the UK about their tips. So I hope I can give you something unique for ophthalmology. And even if you're not interested in ophthalmology, something that you can apply in other specialties as well. So for my personal experience, when I was applying and when people asked me what I wanted to do, I mentioned I wanted to do ophthalmology. And I had to deal with a lot of doubts, other people's doubts, because they thought because I'm an IMG, there's no way I'd get into ophthalmology, at least without applying 2 or 3 times. And that was very disheartening for me. I remember seeing an ophthalmology trainee and he gave me his CV and I just thought, oh my gosh, there's no way I'm going to do anything like this. There's no way I'm going to get into ophthalmology. And I had like the worst headache just looking at his application. And not only did I want to get into ophthalmology, I wanted to get into London because that's where my family is. And again, people were telling me that that was just a fantasy more than a goal. But I didn't listen to that. I only listened to those who were giving me advice and tips on what I need to do rather than telling me that I need to be more realistic. So I did quite well. I was successful on my first application to ophthalmology. I ranked 96th percentile amongst all the applicants, and I got into my first choice location, which was in South London. So yeah, that's what I managed to do. And I want you to see this as an example of, you know, IMGs really can make it. And you've been seeing all the talks today from other IMGs who have succeeded in pursuing their goals. And I hope that that gives you inspiration and motivation. Yes, there are some people who don't make it, but if you want to get in, then listen to those who have. And I'm sure they've given you so many great tips throughout this talk. It's important to cultivate a positive mindset. And yes, you have to be realistic in some sense. You have to be realistic about the work that you have to do in order to achieve your goal, but you don't have to adjust your goal. Because until now, IMGs are not disadvantaged when applying to specialty training. I think someone may have mentioned that probably earlier as well. But when you apply, your application is equal to UK graduates. The only difference is your score. So if you can score well, then you can succeed in getting a training spot. So we'll talk about the application score in a sec. Sorry. So about competition, ophthalmology, if you're aiming for ophthalmology, it is a competitive specialty. It doesn't mean that you can't get in. It just means that you'll have to work a bit harder, start preparing earlier. You have to be very organized and strategic with your resources. So the time, your effort, and money, how you allocate those to different projects, then that's where you need to be a bit smarter. And just keep remembering that applicants are selected based on their score. So if you can optimize your score, then you have a really good chance of getting in. So let's talk about the components of the application score, since this is the deciding factor for you to be successful when you apply for ophthalmology. And there are 3 components. There's the multi-specialty recruitment assessment, the portfolio score, and the interview. So the MSRA is only applicable to ST1 applications. If you are able to apply to ST3, it's not used there. But this test is the basis for selecting who from the applicants get to go through to interview. So that's for shortlisting. And it is also used as a percentage of the final application score. So doing well on this test will decide if your application proceeds to interview and also what your final application score is. So it's really important to do your very, very best and to get higher score as possible. And if you're going to prepare, I would recommend no other than Dr. Aman Arora's MSRA preparation materials. These are going to give you the best chance to do well in the MSRA, get you through to interview, and get you a good application score. Now, the portfolio is essentially a collection of your professional achievements. So it's just evidence of the things that you've done. And it's going to be used in your score as a percentage of the final application. Now, the components of the portfolio, you can call them domains, are different for ST1 and ST3, at least last year. So of the different domains, there are your qualifications, any additional degrees you might have, any prizes and awards, your commitment to specialty, so how you've shown how interested you are or how committed you are to a career in ophthalmology. You also have the multi-source feedback, which is basically comments from your colleagues, both senior and junior, as well as clinical and non-clinical colleagues about your performance as a doctor. There's also presentations, publications, quality improvement, teaching, and then a final score for how well organized your portfolio is. For ST3, it's largely the same, except for two main differences. The first is an essay where you have to answer why you should be chosen for training in ophthalmology. And that's the largest component of the score. It's 20 points out of 70. And then there's another section for experience. So you need to have surgical and practical experience in ophthalmology if you're applying to ST3. This is not needed for ST1. So even if you have zero ophthalmology experience, you can apply for ST1 as long as you demonstrate your interest in the specialty. So my top tips for the portfolio when it comes to ST1, first is to look at the biggest component. The biggest component of the score is the commitment to specialty. So I would say to aim for a perfect score in that domain. Even if you don't get a perfect score, then if you aim for a perfect score, you'll probably get maybe 90% of it or something like that. So there are very easy things that you can do to score well in this domain, such as organizing an elective. So if you're a medical student, you can organize an elective in ophthalmology. That will count in your portfolio. Or if you're already a doctor, you can do a taster week in ophthalmology, and that will count as well. If you see anything interesting during your elective or during your taster week, you can work with the ophthalmologist to publish a case report. You can also attend courses and conferences related to ophthalmology. And there's the FRC Opt exam, which you can also take. It does not require you to have ophthalmology experience, but it is a lot of new information that you'll need to digest. So you've got to give it enough time. If you pass that exam, it's hard to get high points in the commitment to specialty section without this exam. So it's a good way to score well. Other than that, other than those things that are focused on ophthalmology, all the other parts of your portfolio don't have to be in ophthalmology. So your prizes, your publications, presentations, your quality improvement project, even your teaching experience, they do not have to be ophthalmology related, because these are skills that these are transferable skills. If you did a quality improvement project in surgery, then you can use the skills you learned there and do it in ophthalmology later on when you're a trainee. So don't worry if your entire portfolio is not ophthalmology focused. That's okay. Now for ST3, because the essay is a big component of the application, it would be important to get a consultant, ideally a UK ophthalmology consultant, to review that and give you feedback on how you can improve it. I would also recommend that you keep a log of all your procedures, all your surgical procedures, laser procedures, make sure you have a log of that, and your supervisor will need to verify that as well. And you need to download assessment forms. So these are forms where your supervisor can comment on your performance clinically and surgically. Those are also required for the portfolio. So download them early on and complete them as early as possible, so you're not scrambling to compile all of this close to the application deadline. So in terms of strategy tips, it's very basic for any specialty, and anyone can do this. Essentially, you need to first get the scoring criteria, and most specialties have it available online, so you can access this freely and use that to score yourself now. So find out where you are at the moment, and then for each domain in the portfolio, set your goals. So let's say in commitment to specialty, you're 1 out of 12. In 1 year, what score are you going to be aiming for? If you want to get 10 out of 12 or 8 out of 12, and then find out what in that scoring criteria you need to do in order to get that score, and then evaluate the resources that you have and that you need. How much time, how much money, and how much effort are you going to have to put into each of these domains? I would recommend to focus on the less resource intensive ones first. So anything that you can do for free, that doesn't require a lot of your time or effort, try and do those, like attending, doing a taster week, for example, doing a medical elective in your home country while you're a student. Those will all count for your portfolio. And then once you know what you need to do, how much time, effort, and money it's going to take, put that on a timeline. Make sure it's feasible. Give yourself a bit of, don't make it too tight. Give yourself enough time, so preparing early is important. And then start now. Don't say that timeline starts when I arrive in the UK. You can absolutely start that timeline right now, because what you do back home, it can count towards your portfolio as long as you provide the correct evidence. So that's the key to do it. I wish I had done it when I was back in the Philippines. I wish I had started, because when I came to the UK and I found out everything I had to do, it was very, very overwhelming to try and get that all done in such a short amount of time. I scored myself initially 5 points, and then in a year I managed to increase that to 38, and that was very, very stressful. I don't recommend doing it the way I did it in that short amount of time. So if you can do things back home, definitely do that now. I know it is hard to come up with a strategy and a timeline when all of these things are new to you. So that's why we created the IMG Masterclass. It's a step-by-step guide in how you can get into UK specialty training, from completing your eligibility criteria, so the CREST form and things like that, all the way to planning how to build up your portfolio. So if you visit our website, it's going to say that enrollment is closed, and that's because we're updating it, and that will be available in a couple of months. So definitely watch out for that. Now, the interview is the final component of the application score, and since COVID, it has been virtual, and it's even been just 1 station. So it used to be 4 stations, it's now just 1, and it's a communication station involving an actor who is basically simulating a patient or their relative. Now, it's used in your application score as a percentage of the final score, and you also need to pass a minimum score in order to be accepted. So if you do really, really, really badly in the interview, even though you have a good MSRA score or a good portfolio score, then you won't be able to progress. Even if your overall score is good, if there are red flags in your interview about the way that you interact with patients, then that can be an issue. So how do you prepare? As with anything practical, you need to practice, practice, practice. It's quite similar to PLAB 2 scenarios. And Aman has lots and lots and lots of resources about communication skills and PLAB 2 as a former PLAB 2 examiner. So I would definitely look at the resources he has available on developing your communication skills. So those are the 3 components of the application score: the MSRA, portfolio, and interview. If you focus on each of these things individually, then you can do very well in your application. And it's absolutely possible to succeed as an IMG in the UK, as you've seen from all the speakers today. Try not to overcomplicate things. It can be simple. It can be as simple as checking your score now, setting a goal, and making a plan to achieve that. That's all it needs to be. Make sure you keep up to date with the latest guidance, because things do change each year. It's very, very frustrating when things change last minute, but it happens, and unfortunately we don't have control over it. So just make sure you're up to date, bookmark the important sites and check them every few months. And the last thing I would say is that early preparation is key. So really start now, start back home, and make it count. All this time that you're waiting for PLAB 1 or you're waiting to do PLAB 2, make that time count towards your application. So yeah, we have some courses about getting into specialty training. The IMG Shortcut is a free 75-minute course. You can do it online. It's all video based, and it just gives you an overview of how you can achieve this. And the IMG Masterclass is more in-depth, step-by-step guide. And again, that's coming out soon. It is a lot to take in. I know some people really appreciate talking to someone one-on-one. So if that's something that you are interested in, you can book a session with me. I've spoken to lots of IMGs already, and we always are able to come up with a plan for them to get to their next step in their journey. And if that's something you're looking for, definitely book a call. And I'm also now on Instagram. I haven't been very active since January for various reasons, but if you're interested in tips about getting into training or about ophthalmology as a career, then definitely follow me on Instagram. So thank you everyone for listening. I'm so sorry I was late. I hope I've not kept everything, I've not backed everything up. And I hope you've got something useful out of my talk today.
Thank you so much, Kimberly, as always, to the point, key points raised. I think that was really useful, I think. Covered a lot of core ground. I think ophthalmology is one of those specialties that a lot of people maybe think about but don't know too much about. So hopefully this is just given them that little bit of an insight. And also I like the way I always like the way that you cover general positivity and goal setting and targets and aiming high and that kind of thing. It's fantastic. Pooja, I'm thinking you'll share some of those thoughts. I'm just looking through some of the comments here.
Yeah, absolutely. Lots of positive feedback coming through, Kimberly. I've put the links in the chat for the courses that Dr. Kimberly mentioned, and of course that brilliant option of booking one-to-one with Dr. Kimberly. So please look in the chat. And please check out the Savvy IMG website. There's lots of useful information. If you found this conference useful, you'll find their guides just as useful, if not more, because it's full of lots of useful information regarding specialty training. And yeah, please follow Dr. Kimberly on Instagram. I don't know whether Aman's already following Kimberly, but that's a new addition, I think. So yeah, please follow her. So thank you ever so much, Kimberly. I don't want to keep you for too long. I know you managed to squeeze out time to come along. So thank you so much. And
thanks,
apologies
guys.
for
Thank you.
earlier. So
thank you.